So, hi everyone. I am very happy to have with me Dr. Ashish Limbani. He's a proud Damzonian. He's from our Ahmedabad center and he's been a 3-year student with us. And he secured an awesome rank 91 in NEETPG 2022. So, heartiest congratulations, Ashish. You've made us proud.
Thank you so much, ma'am, for the kind introduction. And I am
And
absolutely happy with the rank.
yes, and I think it is very well deserved. Finally, a lot of hard work and efforts put in the right direction bring you great results. And Ashish,
Yes, ma'am, absolutely.
so Ashish, pehle I want to know about your journey in CRISP, and then sort of I will ask you in detail about various aspects of your preparation, bacha. So
Yes,
एक
ma'am.
चीज मुझे बताओ आशीष कि third year में you had joined, DAMS as a regular batch student. So tell me,
Yes, ma'am.
what was going on in your mind at that time when you started your prep with us?
At that time, everybody was joining, so I had joined. Uh,
Okay.
I had taken reviews from senior that it should be joined in third first, and it would be helpful towards the final preparation during your internship.
Right. So now you think starting early helped you?
Yes, ma'am, absolutely.
All right. So Ashish, मुझे थोड़ा सा बताओ that when you were in your undergraduation years,
Yes,
what
ma'am.
was your way of studying at that time? And as you moved closer to the exam, how did it change? And in the internship, so he has cracked NEET PG with a top rank with his internship. So Ashish, with the internship, you were pursuing TND, right?
Yes, ma'am.
So
Ma'am,
let us know the difference in the strategy during your undergraduation years and then during the final phase when you were giving the exam, bacha.
ma'am, I am absolutely practical oriented person. Uh,
Okay.
I I attended the dissection very sincerely and all the practicals and
Uh-huh.
used to gain maximum knowledge from there only and
Okay.
attended all the lectures properly. Uh, Sometimes I used to be the only student studying with the teacher there.
Okay. So that is in
And
your
ma'am,
college time, huh?
yes, ma'am. And ma'am, I have done my MBBS from VJ Medical College, Ahmedabad,
Okay.
and we have the largest hospital of Asia affiliated with it. So the kind of exposure we get here is unparalleled. And
That's great.
so I used to attend all my clinical postings sincerely and used to go to OT whenever I got chance.
That's
And
wonderful.
I try to read standard books as much I can. And Robbins is a must read book.
Great, great. So now you did your first and second year, and then you decided to join DAMS. So now
Yes,
tell
ma'am.
us that when you were doing the classes, how were you studying with it, Hannah? Because a lot of students when they join, they want to now know how to do your professional years as well as preparation for your entrance years. So were you making your own notes? What were you exactly doing? When did you start practicing MCQs?
Ma'am, I was absolutely attentive during the classes. I used to focus and retain as much information and try to formulate concepts as much as I
Okay.
can during the lecture itself.
Right.
And then during 2 or 3 days lecture, I tried to revise my notes coming back to home. And
Okay.
those notes were useful in my university examinations also, ma'am. In the
Okay.
year, I attended the classes of the first 3 years.
All right.
And during my final year, I attended the classes of the final year subjects and then followed it up with the test and discussion during internship. And regarding MCQ practice, I mainly focused on giving the entire papers.
Okay.
I gave around 25 to 30 grant tests, mock test, and
Okay.
CBT included.
Okay.
And match practice is the most important thing that one should focus on. I believe that the top 2000 to 2500 students maybe have uh, same knowledge, but it's the strategy and the exam taking skills which differentiates.
Right. So why don't you tell us, if I ask you, Ashish, what are the three important ingredients to do well in the competitive exam like NEET PG or INICET? What would those three things be from your side?
Making strong concepts not
Okay.
just trying to remember things.
Mm-hmm.
And I would say try to do previous year questions during the initial phase of preparation only. I actually
Okay.
did it towards the end, but I now realize that it is better if done towards the beginning of the preparation only, so that you can understand which are the favorite topics which the examiners love. And ma'am, the topics are repeated in every exam, be it NEET or INICET.
Right.
And the third most important thing is giving grant test, and preferably during the time during which exam is going to be taken.
Okay.
So during 9 to 12:30, I used to give grant test, and CBT is also very important thing. You get the real exam feel, and can get used to the environment. And ma'am, the
Okay.
exam center which I got in NEET was actually the center where DAMS CBT used to be taken.
Really? Okay. So
Yes,
the place must be very familiar to you then.
yes,
I
ma'am.
think that that takes away a part of the anxiety, that you, if you're
Yes, ma'am,
familiar with the
absolutely.
place, so at least a
Hmm.
part of the anxiety is taken care of, right? Acha, Ashish, you mentioned, about having strong concepts, and
Yes.
you also talked about PYQs. So now I want to
Hmm.
ask you, Ashish, you've given the papers, and what do you think that they are asking? Do you think that the theory content is quite in depth now,
I
both the
mean,
exams?
NEETPG, it was not in that much depth, but the questions were absolutely good. All the questions were clinical, very little factual questions. And
Yes.
after talking my friends with after giving the exam, everybody said that whatever rank we may get, but we are content with the exam that we gave, and everybody was happy with the type of paper it was. The
That's
previous
great.
year question, NEET 2021, was a bit of more factual than this one, but
And there
this
were
was an
less
awesome paper.
PYQs. I think there were less repeats, especially
Yes,
in
yes,
NEET
yes,
this year. So,
yes, ma'am. And
yes,
ma'am,
yes.
NEET this year was better paper than INICET.
Okay. Yes, INICT did ask some, vague things, but I
Yes,
think
ma'am.
NEET was quite clinical, and that is why you
Yes, ma'am.
enjoyed giving the
Absolutely,
paper
Glenn.
as well.
Yes, ma'am.
Okay, and now tell us something about the exam skill. Ashish, we all talk about sort of improving your grant test scores. So, how did you ensure that you are on the right direction, and how did you ensure कि आपके number of correct questions increase हो रहे
Hmm.
हैं?
Ma'am, so I gave one or two grant tests during my final year itself, just for practice, and I gave one grant test just after completing my university exams, and
Okay,
I got about 130 questions correct in that.
all
And
right. So you could know your baseline, right?
yes, ma'am. And it is absolutely essential to start giving grant test at the starting of your preparation as early as you can. Many people say that I have not prepared this much and how can I
Yes.
get good marks in grant test? But that is not the concern. You must start giving grant test as soon as you can. And it is not about evaluating yourself towards the initial part. You learn the paper solving skills, and you also get to know about the kind of questions that can be asked in NEET and NICT. And ma'am, then for about 5 to 6 next grant test, my scores remained the same or decreased a
Okay.
bit in
Okay.
some. But after doing many subjects, I could improve the score, and the maximum I got correct in grant test was 169 correct.
And how much do you think have you got in NEET PG, number of correct questions, Ashish?
And I got 171 correct and 657 marks.
So that's very close to what you achieved in Grand Test as well,
Yes,
right?
ma'am.
Okay, so that is great. So Ashish, also tell us, there is a very important aspect of the competitive exams, even for professional exams, I would say, and that is revision. Yes. So बहुत सारे बच्चे initial phase में पढ़ पाते हैं, but
Hmm.
towards the end when they have to revise, that becomes a problem, and then they get stuck. So how did you plan your revisions?
Uh, Ma'am, I could do only about 1.5 reading, I would say.
Okay.
I
But
couldn't
that
do
means
many
you,
reasons.
so
Yeah,
no,
ma'am,
I
but
think, Ashish, that means that you were very, very thorough with
yes,
whatever
ma'am.
you had done in the classes. So, if you are
Ma'am, it's
able
been
to
like
do,
that only. I did not revise during my 12th also. Uh, one to two reading would suffice for me. But
Okay.
there should be different strategy for everyone. Everyone should decide how much revision do they need. If they are
Yes.
comfortable with 5 to 6 reading, they must go for it. Or if one feels that I can do it with one or two reading, then it's also fine. But you have to formulate your own strategy. And
Acha,
ma'am,
Ashish, ek aur,
I was actually attending the clinical postings thoroughly, used to talk with my professors and seniors and got to learn many things there also. And
great.
ma'am, college is everywhere. You have to just capture it. It's not
That's
only in
very
the
true.
books.
You have to take all the opportunities as learning experiences, right? Acha,
Yes, ma'am.
Ashish, also something that I want to ask you is that, a lot of people try and learn the content from the MCQs. Okay.
Mhm.
So, do you think that works out? Because since we are preparing for exams which are asking a lot of things,
Mhm.
INICT has been asking things in a lot of depth as well, right? So,
Yes.
what is your strategy, and what do you think is a good way to prepare?
As I said, one should go through the previous year questions of, I would say, 4 to 5 years during the starting of preparation to just know the topics which are important and are being repeated frequently. And one should go in depth of those topics. And solving MCQ without knowing the theory is not okay. You must
Yes.
know the theory. And if you are good with your concepts, you can solve any type of questions which are being asked.
That's true. That's true. Okay, Ashish, अब मुझे बताओ, you've given the exam. Now tell us something about the paper itself. Although you have said that it was clinical and not factual, but do you think that there were certain subjects which had a very high weightage, or certain subjects which were more difficult, or any input, or if somebody asks you, can they leave a few subjects and then go? Various aspects of the exam itself. What would you tell them?
No, ma'am. Leaving a subject is a big no. Uh,
Yeah.
the short subjects are the one which differentiate the ranks among the toppers.
Yes.
Everyone studies medicine and surgery, PSM, Ops, Gynec, but the short subjects are the differentiators. And you can get good marks in reading those 150 to 200 pages notes. And that is actually very high yield. Nothing
Yes.
very difficult is asked from those subjects. And when talking about the high important subjects, Ops Gynec I would suggest is the most important because medicine, surgery, and Ops Gynec there are same number of questions, about 20 to 25. But
Yes.
Ops Gynec can be done in very short 300 to 400 pages notes, while surgery and medicine notes are like this big stack.
Yes, yes.
I
Okay,
actually didn't study medicine during the last 1 or 1.5 months,
okay.
but actually my concepts were strong in that, so I didn't require revision. Uh,
Yes.
During the initial phase, I had not done that much of remembering things, and towards the last 15 days, I did those things and could balance
Okay.
out everything. Remember, the most important are the last 7 to 10 days.
So what
You
did you
need
read
to.
in what did you read in those last 7 to 10 days, Ashish?
And before the last 7 days of INICET, I decided to do the previous year questions by watching the videos that we have on DAMS, eMedicoz.
Yes.
Because the questions exactly are not repeated, I wanted
Yes.
to know the explanation that teacher is
Hmm.
giving.
Hmm.
And I also did AIMS capsule of
Okay.
around 8 to 10 subjects before AIMS.
Okay. Okay.
And
And before NEET?
before NEET, actually, the things which I found difficult during INICET, I tried to revise those things.
Okay.
Ma'am, I had done biochemistry, pharmacology, microbiology, PSM, forensic medicine, and
Okay.
the DVT of obstetric and gynecology towards the end.
Okay.
Yes,
So
ma'am.
great. Now, Ashish, something about the exam strategy when you are attempting the paper, those 3 hours are very important, right? So,
Hmm.
आप कैसे अपना focus बना के रखते हो? And there may be some questions जो immediately देख के लगता है I don't know
Hmm.
this. So, how do you keep your calm? How many questions did you attempt? Any tips on that as well?
Ma'am, I kept my timeline like I need to do 35 to 40 questions in half an hour duration,
Okay.
so that I can complete my paper in around 3 hours and I have half an hour for reviewing the questions. This can happen a little bit plus minus during the exam, but you have to reformulate your timing according to that. Like I have this much time remaining and I need to do suppose this much of question. Uh, then in 20 minutes I need to do 30 questions. You don't need to look at the time after each and every question. That will
Yes.
just increase the anxiety. And take break of 30 seconds to 1 minute after doing around 40 to 50 questions and refresh
Okay.
yourself.
Okay.
And ma'am, if you can eliminate one or two option, you must attempt the question. I attempted 198 question in NEET and INICET both.
Okay.
I got 216 rank in INICET, and
That's also wonderful.
after improving the weak areas, I could get this rank in NEET.
Great, great. So, that is why we say that every exam teaches you
Yes,
how to
ma'am.
do it better in the next one. So, paper dena बहुत ज़रूरी है to
Hmm.
learn where you need to work. नहीं तो इतना vast है, you can keep working and working and
Hmm.
working. But if you know your weak
And
zone, you can do a targeted study.
yes, ma'am. Targeted study is important. It is not like people say you read Harrison and 100% paper will be from that only. That is not a wise thing. Rather,
Yes,
you focus your revision on high yielding stuff like DVT towards the end. It
yes.
covers majority of the stuff, and the things which you have studied anywhere, you might find out some way to answer the question.
Great. So I think that is a very, very, I think something that I could gather from the interview is that Ashish from the beginning was, could find out how to do smart study, है ना, Ashish?
Yes,
And
ma'am.
he has tried to gather information from, from his clinics and from DAMS,
Yes,
and so
ma'am.
you've stayed active throughout, and I think that always helps. So Ashish, what branch do you want to pursue, bacha?
Ma'am, general surgery.
General surgery. That's awesome.
Yes,
So I'm great. You will be a great, great surgeon. And ऐसा तो नहीं Ashish, have you thought of your, super specialty branch as well?
ma'am. Ma'am, right now I am interested in GI surgery, surgical
Achha.
oncology, and CTVS. But that would be
So,
more clear after doing MS.
yes. So take good exposure, then decide,
Yes, ma'am.
the zone that you would want to pursue your subspecialization in. And I'm
And
sure whatever you,
I did everything I could during my internship also. And I had taught laparoscopic suturing to my senior also.
wow, that's amazing, Ashish. So I think आपका बहुत interest है surgery में, and that's what should
And I used to
uh,
enter all the OTs of neurosurgery and CTVS and
wow.
gynecology, general
That's
surgery,
that's
everything.
great. आशीष यही पैशन भी चाहिए टू परस्यू अ
Yes,
ब्रांच
ma'am.
तभी यू विल बी एंड आई कैन टेल दैट यू विल एक्सेल इन योर ब्रांच बिकॉज आई कैन सी द लव दैट यू हैव फॉर सर्जरी सो दैट शुड
Yes,
बी द
ma'am.
डिसाइडिंग फैक्टर एंड आई विश you a great bright future ahead, Ashish. And I would
Thank
say
you,
thank
ma'am.
you for making DAMS a part of your journey. It was a pleasure to be able to connect with you as well.
Thank you, ma'am.
And in the end, I would just like to congratulate your parents. I'm sure their support
Yes,
has been
ma'am.
tremendous. And,
Yes, ma'am.
give my regards to them as well. So,
Yes,
Ashish, in
ma'am.
the end, do you want to say anything motivating to the students who are listening out to you?
Ma'am, just be confident that you can do it and you will make it through.
That's true.
Ma'am,
So,
there has been
confidence.
a big role of my father and mother during the preparation.
Yes, I'm
My
sure.
father is actually gold medalist in B Farm, and he
Okay.
helped me very much in pharmacology and even in
That's
some other
great.
subjects also.
That's awesome. So, it's always great if parents can contribute. They contribute in the form of support system for sure, but when they
Yes, ma'am,
contribute in
absolutely.
academics, it's very interesting, right?
Yes, ma'am. My parents are here only.
Oh, let's have them. Let's have
Yes,
them if
ma'am.
if they're around. Hello, sir. Namaskar, sir. Heartiest congratulations, sir. Ashish has really made you proud. And he was just talking about you कि आपने उसको किस तरह से help किया है, even in pharmacology and few other subjects. So hats off to you, sir. Heartiest congrats.
Okay, thank you, madam.
And
It is all
and sir,
because of it is all because of strategy, smart work, and very focused approach. And
हाँ जी,
mainly, you have to prepare your expected uh, uh, paper. What
yes,
kind of questions are being asked? And in every question, there is a concept. Because if it is cardiotoxicity and hepatomegaly, what could be the disease?
yes,
Or
yes.
if it is arsenic poisoning, what are the characteristics of it? So we have to go in deep in the concept, and according to that only we can achieve. It is not only because of just going through, and it requires very thorough knowledge, and in last stage a very focused approach on
Yes, sir.
particularly past year questions, and accordingly we have to formulate our paper. Ki what kind of question are asked. So we are very happy. Here is his mummy also.
Hello, ma'am. Heartiest congratulations. Your son has done really, really well, and he's made each one of us proud. आपको भी बहुत proud हो रहा है और हमें भी बहुत हो रहा है. And I think all his hard work has, brought him here. मैम, आप हमें आशीष के बारे में कुछ ऐसी चीज बताओ जो जो पढ़ाई से हटकर हो. आशीष किस चीज में और बहुत अच्छा है?
उसका जो नॉलेज है वो एकदम थ्रू आउट है, जो बेस क्लियर नहीं होता तब तक वो छोड़ता नहीं है। और सभी का आशीर्वाद भी उसके ऊपर इतना ही है, जैसे आप गुरुजनों का। और जैसे जो कोई पेशेंट आता है, घर पे आता है, और जैसे कोई ऑनलाइन कोई सेवा मांगता है, मतलब कि कुछ पूछता है कोई बीमारी के बारे में, इतना वो डीपली समझाता है, तो 90% तो बीमारी ऐसे ही दूर हो जाती है। तो
That
सभी लोगों का आशीर्वाद भी उसके बाद बहुत है। जैसे कोरोना में उसने सोसाइटी पर बहुत सारे लोगों पर इतना ही सेवा दी है कि सभी
वेरी
लोग।
गुड आशीष. आशीष, मुझे और भी ज्यादा प्राउड हो रहा है. इवन मोर देन योर रैंक. मुझे अब बहुत खुशी हो रही है ये जान के. तभी
सभी लोगों का साथ, गुरुजनों का और सभी लोगों का बहुत आशीर्वाद उनके ऊपर, तो सफलता मिली है, वो उसका भी है, पार्ट है।
आशीष, आप बहुत आगे जाओगे और आप बहुत अच्छे डॉक्टर भी बनोगे. आपकी मम्मा ने आपकी ऐसी स्पेशलिटी बताई है जो पढ़ाई से भी हटके है, और एक डॉक्टर में वो जब वो स्पेशलिटी होती है तो वो उसमें चार चांद लग जाते हैं, है ना? सो हैट्स
Yes,
ऑफ टू योर
ma'am.
पेरेंट्स. हैट्स ऑफ टू यू एज वेल आशीष. एंड जैसे हो वैसे ही रहना. और
Yes,
वी विश यू अ वेरी वेरी ब्राइट फ्यूचर अहेड, बच्चा.
yes, ma'am. Father says that you don't need to do this for money. You just do it for passion and for serving the society. Uh,
दैट्स सो
Money
नाइस.
can be earned easily by other branches also. After doing a BTech from IIT, you can get package in 50 lakhs or 60 lakhs. But this is the way by which you can serve the society, and it is the most pious profession. So they insisted me
सो नाइस.
to take up MBBS.
दैट्स सो नाइस. सो बहुत अच्छा लगा आशीष, मम्मा पापा से भी मिलकर. और उनको मेरा नमस्कार बोलो दोबारा से. एंड
Yes, ma'am.
आई विश यू अ सुपर ब्राइट फ्यूचर आशीष. टेक केयर बच्चा. थैंक यू सो मच.
Thank you so much, ma'am. Thank you.
ओके, टेक
My
केयर.
sister is also here. She is
अच्छा,
in.
तो उसको क्यों छुपा कर रखा था? हेलो.
हेलो मैम।
And she is in
आर्य.
12th currently, and she also
वाओ.
wants
सो
to be a doctor.
व्हाट इज हर नेम? व्हाट इज हर नेम?
Komal.
सो कोमल, आप क्या करना चाहते हो बच्चा?
मैम आई आल्सो वांट टू बी एन एमबीबीएस स्टूडेंट।
वाओ. सो आशीष, आर यू गाइडिंग हर?
Yes, ma'am.
ग्रेट. आई एम श्योर कि आशीष आपकी जरूर हेल्प करेगा कोमल. एंड आई ऑल्सो विश यू ऑल द वेरी बेस्ट. और आज भैया का सक्सेस देख के अच्छा लग रहा है?
यस।
यस, दैट्स वेरी नाइस. ओके, सो अभी आपके बोर्ड्स हो गए या हो रहे हैं?
नहीं, अभी 12th स्टार्ट हुआ।
अच्छा, अभी स्टार्ट हुआ है.
Yes,
चलो,
ma'am.
गुड गुड गुड. सो टेक केयर कोमल. आप अच्छे से पढ़ाई भी करो और अपना ध्यान भी रखो, और भैया से बहुत सारी अच्छी अच्छी चीजें सीखने को मिलेंगी आपको.
यस मैम।
चलो, ठीक है. थैंक यू आशीष. इट
Thank
इज
you
वेरी
so much,
स्वीट.
madam. It
थैंक यू
was
आशीष.
great talking with you.
Same here, Ashish. It was a pleasure to meet your family. मुझे ऐसा लगा मैं वहाँ पे आ गई हूँ तुम्हारे पास. So
Thank
it's
you, ma'am.
great.
Thank you.
Take care, beta. Bye bye.
Yes, ma'am. Bye.